As physical therapists, we see patients with all sorts of neck, shoulder, and arm pain, but this is the one type of pain you don't want to just dismiss. What's up, y'all? This is Carolina Doc PT, and today we're going to be talking about a pain that you may experience, or hopefully you won't be experiencing anytime soon. That is pain that is going to your left arm. That is a unique kind of pain, and it's not one that you want to just write off as being just like any other pain that you may have in the rest of your body. The reason for that is it could potentially be referred pain from your heart. So this pain that your heart may be experiencing because it is having, maybe there's a blockage, and so the heart is having to work harder, and it's not feeling as comfortable as it normally would. It's going to send sensory information up to your thoracic spine, and it's in a similar location as the nerves that are coming from your shoulder and your neck and your arm. So your brain, when it receives that input, it actually receives that as referred pain. And so it senses that you're actually having pain in your arm. And because the heart actually sits to the left of your chest just a little bit, it goes more predominantly to the left side, although it could go to the right side. It's just not as common that it would do that. But that pain coming from that your heart is sending out, those pain receptors, or even, let's say, not even pain receptors, that might confuse the issue. Just the sensory information that is going from your heart up to your brain to say that something is not working right. When it goes through that thoracic spine level, it converges with these other nerves from the left side of your shoulder and down your arm and even part of your neck. And so then your brain registers that as pain in the left shoulder. So that makes left-sided shoulder pain very different than right-sided shoulder pain for physical therapists, because we want to make sure when we are working on, say, like a rotator cuff, or maybe you have like an elbow sprain or something, we want to make sure that we have cleared the heart level for pain that is going to coming from that side of the body. So it's let me speak from a little bit of experience. I've had 3 patients that I can tell you off the top of my head. One of them is my brother, who he was having kind of this left-sided shoulder pain and arm pain, and it just wasn't behaving as an orthopedic pain would. Orthopedic pain, or coming from your shoulder, if it's a muscle or a joint, that's going to be more sharp with movement, but you're eventually going to be able to find a place that you can position, or a way that you can position that arm where you're not going to be feeling that same irritation or that same pain, and it will at least calm down a little bit. That's at least very typical. It's not something that's just gonna throb and throb and throb and get worse and worse and worse if you haven't had any sort of movement. Also, that left or arm pain is usually precipitated by having done something movement related, where, like, okay, maybe I fell against something, or maybe I was lifting something and I had pain after that. It's not generally just going to come from nowhere at all. Okay, like there's no known source. I don't know exactly what's happened. My left arm has just started hurting, and it's just been really bothering me. It's really killing me. That's unusual. That doesn't look like arthritic pain. Arthritic pain doesn't look like that. Even a tear. Now, a really bad rotator cuff tear could feel something like that, but it's going to be very, very sharp, and that's going to be something that will be very obvious. That, like, okay, I can't even hardly lift my arm. I can't lift my arm, and it's sharp pain. Every time I try to lift it, it makes it worse. Yeah, that's an orthopedic type pain. That's something going on with that joint and the muscles or the ligaments or the tendons involved in that joint. But just pain that it's just hurting and there's no known cause, you need to pay close attention to that. So my brother, as I mentioned, he was having that type of pain. I kept telling him, like, dude, this seems odd, like what you're having. I even sent him to a physical therapist who was working with him on it, which is not real good because he doesn't. My brother doesn't live in the same area that we do, and that his pain just kind of kept going along, and it got to where he couldn't even cut the grass because of his shoulder pain. And then he started having shortness of breath. He smartly took himself to the hospital. He was in the middle of having a heart attack at that moment, and thankfully the cardiologist and cardiac surgeon were able to jump in really quick, and now he was able to respond so quickly to it that he doesn't even have any heart damage from it. So he was very, very lucky. I've had another patient who this particular patient was having tons of left shoulder pain, and partly it was hard to tease out because this individual was also very large, and so anytime they were going to try to stand, their arms had to use there had to be a lot of work being done. And so you think, well, okay, this person's really large, and so it very well could be that they've strained the muscles in the rotator cuff. They probably may have a tear in there a little bit, and just there's irritation overall. But I kept telling this particular patient that there was something about it that just didn't seem like an orthopedic issue to me. And in addition to the fact that this was a very large patient, so even if, like, I would check the person's vital signs and things, and they actually would come back normal, but there was something that was just not right about it. This person wound up taking themselves to the hospital when they were having some shortness of breath, but unfortunately they waited too long. So after months of my and some other therapists attempting to prod this patient to go to the hospital, when they finally did, unfortunately it wound up being too late, and they wound up passing away from a cardiac arrest. So these instances are part of the reason that I wanted to make this video, because let me say, not everyone is going to experience a heart attack in this way. I will say only about 40 to 50% of patients will experience left arm pain as a result of having a heart attack. A lot of times it's not women. That women may be a little bit lower on that category. Women oftentimes are experiencing heart attacks as nausea sensations, and again, that has to do with just how a female's body is wired. It's wired slightly differently than a male's body. Males typically could have this left shoulder type of pain, but then also, as I say, that's only 40 to 50% of the time. So 50 to 60, they might not at all. Other signs that you would be looking for would be, if you're having shortness of breath, certainly, let me say, difficulty breathing. If you're having that alone, should be worth a trip to the ER. If you're having chest pain by itself, trip to the ER. If you're having symptoms in combination, so I would say left arm pain with shortness of breath, left arm pain with headache, left arm pain with dizziness, left arm pain with jaw pain even. So if you're having either chest pain, or if your left arm pain is really, really severe, or if you're having left arm pain that is in combination with other signs and symptoms like shortness of breath, dizziness. Also, let me just say, it tends to happen on the left side of the body because your heart is a little bit positioned more to the left side, but you could have right shoulder pain. It could be across both shoulders. It could be neck and jaw pain. So those are all different signs and symptoms of heart attacks. But specifically, what I want to focus on is this left-sided pain, or this left arm pain, because with one of these patients that I'm speaking of, they actually had gone to their physician multiple times, and the physician said they were fine. They weren't. So left arm pain can easily be chalked up to, hey, this is arthritis, this is a rotator cuff, this is irritation of the muscles, but not always could that be, or not always are those the issues. Potentially it could be from your heart. So if that pain that you're experiencing in your left arm is more movement related, if you can press in different areas on your arm and reproduce that pain, if you have had an event that, hey, I was lifting something and now my left arm hurts, or I fell and now my left arm hurts, and because I landed there or whatever, okay, that's probably, it's never wrong to get it cleared, but that's probably related to that orthopedic issue, that bone, that joint, that muscle, that tendon, that ligament. But if you cannot point to a specific event, and this is left arm pain that's just been coming on, and especially if you're combining it with other symptoms, please go get that looked at. Don't just disregard that. If it keeps going on and you have already gone to a physician, go to the emergency room. Okay, your primary care physicians are not always the best at picking up on emergency issues or the development of emergency issues. That's what the emergency room does. And conversely, the emergency room is not really good at treating just regular everyday stuff. That's what your primary care physician does. So be smart, pay attention to what your body is saying, and Lord willing, you will avoid being any sort of a statistic like, unfortunately, one of these patients that I'm speaking of became, and thankfully that as my brother did not become. So I hope that this has been a little bit educational for you, and if you have any questions, please put them in the comment below. If you thought this was beneficial, please like this video and share it out to other folks so that we can get more awareness of this one particular type of arm pain that you really want to pay a little bit more close attention to than you otherwise might would. All right, y'all have a good one. Later.